This is the recording for nursing pharmacology, anticoagulants, diuretics, fluids, and electrolytes. The first drug we're going to talk about is warfarin. Warfarin, its MOA or its action, it's a vitamin K antagonist, so it works against vitamin K. We need vitamin K to clot. So its primary use is an anticoagulant. With all our anticoagulants, we're going to have bleeding as a side effect. So side effects, and this is going to go for all our anticoagulants or anything that prolongs bleeding time. Abnormal bleeding as a side effect, and we want to decrease bleeding and injuries by using an electric razor, soft toothbrush, and avoiding contact sports. Key nursing for warfarin, for a client receiving full anticoagulant therapy. The PT or prothrombin time should typically be approximately 2 to 3 times the normal value, depending on the indication for the therapeutic anticoagulation. In healthy people, an INR of 1.1 or below is considered normal. An INR of 2 to 3 is generally effective. Therapeutic range for people taking warfarin for certain disorders. Um, a prothrombin time test measures how long it takes for a clot to form in a sample. An INR uh, is a type of calculation based on PT levels. Interactions is going to be our ginger, ginkgo, garlic, feverfew, those herbs, because those herbs all prolong bleeding time. And if you mix it with any kind of medication that also prolongs bleeding time, you're going to have more risk for abnormal bleeding. Aspirin is a platelet inhibitor, or so it keeps platelets from sticking together. So that's also going to interact with warfarin. Um, any drugs that prolong bleeding time are interactions, and our antidote is vitamin K. So if somebody's INR is too high, you'll likely have to administer vitamin K. And warfarin is a PO medication. Heparin is a subcutaneous medication typically, and it can also be given as an IV drip. Its action is an indirect thrombin inhibitor. Its use is for clot prevention. It's an anticoagulant. It's a parenteral anticoagulant, so subcutaneous and IV. And our side effects with any anticoagulant, again, are abnormal bleeding, and we want to decrease bleeding um, and injury risks by using electric razors, soft toothbrushes, and avoiding contact sports. So our key nursing is going to be a little bit different because of the way these two drugs are given. So heparin, so this is for sub-Q administration. So cleanse the site with an alcohol swab, insert the needle, inject the heparin, and observe for bleeding. We do not aspirate or we do not massage the site. Doing either of these can contribute to bleeding or tissue injury. And with these, again, all the same herbs that can cause prolonged bleeding time we want to avoid while taking anticoagulants. So our ginger, ginkgo, garlic, feverfew, aspirin, and any drugs that potentiate or prolong bleeding time. And our antidote for heparin is protamine sulfate. Please know the difference in your antidotes. Heparin is protamine sulfate, and warfarin is vitamin K. Um, warfarin is the generic, Coumadin is the brand name. K, like Coumadin and K have a similar sound. I know Coumadin starts with a C, but K and Coumadin, when I was initially learning this drug, for that helped me differentiate the antidotes between warfarin and heparin. And then also, if you remember the mechanism of action with your warfarin, it's a vitamin K antagonist. So to fix um, the having the too high of the INR, or if they had too much warfarin, if they had too much warfarin, you would give them vitamin K. Enoxaparin is a low molecular weight heparin. This is also given for clot prevention. It's an anticoagulant. It's parenteral. This is only subcutaneous. The same side effects, abnormal bleeding. We do the same things to decrease bleeding and injuries, electric razor, soft toothbrush, avoiding contact sports. Enoxaparin comes in a pre-filled syringe. The nurse should not expel the air bubble that is in the pre-filled syringe prior to administering the medication. The duration of action is 2 to 4 times longer than that of heparin, and doses are weight-based, and there's no labs needed. The same thing with the herbs. And I'm adding the feverfew to the heparin and the enoxaparin because that also prolongs clotting time. Like before, it prolongs the time it takes to clot, so you're at risk for bleeding. So the ginkgo, ginkgo, garlic, feverfew, aspirin, and any other drug that can prolong bleeding time. Apixaban is a factor ZA antagonist. It's an oral anticoagulation given for atrial fibrillation. Its side effects are bleeding. Streptokinase. So streptokinase is a thrombolytic. Out of all of the drugs that we've just talked about, the like apixaban, enoxaparin, heparin, and warfarin, these all are anticoagulants. They prevent clots from forming. The streptokinase is our first one that on this sheet that's a thrombolytic. It lyses clots, so it actually dissolves the clots. The rest of the medications are warfarin, are heparin, are noxaparin, and are abixaban. Those all only prevent new clots from forming or keep that other slot, the if they've already discovered a clot, like if you're giving heparin for a DVT, um, it will prevent it from getting larger, but it's not going to dissolve it. Our streptokinase is the first drug on this sheet that's an actual thrombolytic that will dissolve the clot. So it's used for dissolving clots and it's for bleeding. And it's you must give it within 12 hours of the onset of an MI and within 3 hours of a thrombolytic stroke for maximum effectiveness. So there's a very specific time frame with streptokinase um, for an MI or a thrombolytic stroke. So with a thrombolytic stroke, you are trying to dissolve that clot and it needs to be given within 3 hours. You would never give this for a hemorrhagic stroke or a stroke that was bleeding, only for a stroke that was caused by a clot. And with streptokinase, or like thrombolytics, they can also sometimes be used to declot PICC lines. Furosemide acts by blocking the reabsorption of sodium and chloride in the loop of Henle. The loop of Henle is just like a distal loop on the nephron. It's a loop diuretic. It's a very commonly used loop diuretic. It's given for hypertension to reduce edema associated with heart failure, hepatic cirrhosis, and or chronic renal failure. It's a potassium wasting diuretic. So electrolyte imbalances are the most are something that could be a side effect. The most important, which is hypokalemia, or hypokalemia would be low potassium levels because it's a potassium wasting diuretic. So hypokalemia signs and symptoms include muscle weakness, muscle cramps, severe muscle weakness leading to paralysis, low blood pressure, hypotension, lightheadedness or faintness, abdominal heart rhythms, arrhythmias, excessive urination, polyuria, excessive thirst, polydyspnea. With any diuretic, if we can, we want to give that early in the day or in the morning to avoid nocturia or our client getting up or having to get up in the middle of the night to urinate, disrupting their rest. Nursing, we want to check the potassium level before administering the drug. If the potassium levels are below normal, notify the healthcare provider before administering. Drug, because hypokalemia may cause dysrhythmias in patients taking cardiac glycosides, combination therapy with digoxin. Hydrochlorothiazide, this is a thiazide diuretic. It acts in the distal tubule, blocking sodium reabsorption and increase potassium and water excretion. This is also a potassium wasting diuretic. Mild to moderate hypertension, edema to mild or moderate heart failure, liver failure, and renal failure. Your side effect that you're looking for is that hypokalemia again, or that low potassium level, because it's wasting potassium. And we give it in the morning just to avoid that urination at night. And we check blood pressure and heart rate prior to administration. Interactions include other hypertensives. It can have an additive or synergistic effect. Spirulactone, this is our potassium-sparing diuretic. So we might have hyperkalemia with this one. Spirulactone is a potassium-sparing diuretic that inhibits the action of aldosterone, resulting in a excretion of sodium. It's given for hypertension and edema. Spirulactone does such an effective job of retaining potassium that hyperkalemia may develop. The nurse should expect a decreased sodium level. Give with food to increase absorption of the drug. Do not give with vitamin K supplements, pregnancy category C, and then contraindications are impaired renal function and hyperkalemia. Mannitol. Our other three diuretics, they're like for hypertension or we're trying to get fluid out of the body, like let's say for congestive heart failure or liver failure. Our mannitol is a very specific diuretic. It's an osmotic diuretic and or it's given for a very specific reason. Reduce intracranial pressure due to cerebral edema. Osmotic diuretics are rarely drugs of first choice due to their potential for toxicity. It is a highly potent drug that is given by the IV route. For our fluids, we're only going to look at one today. Well, for a maintenance fluid, and that's going to be our normal saline. Um, this is sterile water and sodium chloride. The percentage is 0.9% sodium chloride. It's often used to treat fluid loss due to vomiting, diarrhea, or surgical procedures, especially when the blood pressure is low. Our side effects that could possibly happen is fluid overload. So we have albumin. Human albumin is derived from the plasma of donors, and it's used to treat low albumin plasma blood and plasma blood volume. Patch red blood cells. This is to replace red blood cells, and it increases red blood cells. Your interactions are blood transfusion reactions. There can be several. We'll go more into depth in that in level 3 when we do our blood administration skill. Things that you need to know for sure for now is it's packed red blood cells. It comes from donor cells. You only administer it with normal saline. You don't give it with any other fluid, only normal saline. And each unit must be completely administered within 4 hours from when it was started. And this is just if you leave the blood hanging longer than 4 hours, you increase the risk for any kind of bacterial growth as the blood warms. So, packed red blood cells, they come from donated blood. You give it for like blood volume loss, like if they are bleeding um, from an injury, or if they're bleeding from a GI bleed, or if a woman's bleeding postpartumly, you may anticipate giving packed red blood cells. And you only give it with normal saline, and each unit must be complete within 4 hours. Potassium, it's an electrolyte, and it's given for potassium It's a potassium supplement and it's given for hypokalemia, and its side effects are hyperkalemia. And the antidote is sodium polystyrene. Interactions are potassium supplements and potassium sparing diuretics and ACE inhibitors can increase the risk for hypokalemia. And that will conclude the recording for anticoagulants, diuretics, fluids, and electrolytes.